You okay? You want some water?
Are you threatened by me?
Not at all.
Well, you should be. You let him know what I told you, I will sue you for everything I lose in the divorce.
Can I have your arm, please?
You broke it!
13 is about as intimidated by our psychopath's newfound jelly arm as the Turkish shooter by the Olympics. Very excited to be reacting to House MD Season 6, Episode 12, Remorse. On this channel, we're reacting to all 177 House episodes, and this will be episode 123. Let's see if I can get the diagnosis before House does as a doctor working in London.
We agreed that you would do the slides.
So please try to figure it out, because when the client dumps me, I need to know who to fire.
Never got this. I'm not drunk.
I had no idea he was drinking again. I put the graphs directly from the spreadsheets.
Run.
My ears! Oh my God!
Did I mention that the 27-year-old female is really hot? Her husband is really not.
Gimme, she's hot and her husband is ugly. She loves something about him.
She changed her diet a few months ago.
Raw foods, lots of nuts.
It's the heart.
Cardiac arrhythmia presenting as ear pain.
Wow, I can't believe I get all these doctors and such good-looking ones, too.
It's almost like we don't all need to be here.
You can't sleep in your own office?
Some idiot I went to med school with keeps leaving messages. I should drop by for lunch. He was sort of part of my therapy, so I switched my final paper with his. I was testing a theory. Thought that our professor was biased against me. I was wrong. I got an A.
And this is who you choose to apologize to. Great to see what a success your therapy was.
27-year-old female with persistent ear pain. Next. 27-year-old female with an ugly husband who isn't rich. Why'd you miss out all the important details? In all fairness, it could be diagnostically relevant. If she has a problem with one of her senses, then it's reasonable to think she could have one with another. Interestingly, after 5 minutes of watching this episode, we've gotten just one symptom, but at least we know House stole a colleague's final paper, and that even though 13 was against the idea of taking a patient for her looks, she still went ahead with the whole team to assess the situation. Brilliant. In all fairness though, we know the patient changed her diet recently to be more healthy, so why is that? Usually it's triggered by a life situation. Maybe she lost a parent recently and that was a wake-up call. Or maybe she watched a video about a topless man with no shirt and shoes screaming about seed oils in a supermarket.
All of your chips, all of these chips, seed oils, every single thing in here, seed oils.
Either way, that could be another clue. So far, what do we have? In its most basic form, we have something called tinnitus, which is ringing in the ears. The most common causes are repetitive exposure to loud noise, resulting in hearing loss, but House doesn't do common. Spicier House-esque causes include tumors of the nerves that detect hearing on both sides, but that would be more gradual onset as the tumors grow. Vascular disorders like narrowing of the arteries of the neck or increased pressure in the brain. Glomus tumors, which are vascular tumors in the ear that can cause ringing. Malformations like Arnold Chiari could do it, although that would be strange to present as 27 unless something else triggered it. Maybe the acute intense stress caused it to manifest when it hadn't before. Definitely need more clues.
We did find an arrhythmia, but it's not from your arteries. They're clean.
Hey, Valerie.
Yes.
You don't blame me, do you?
It was like someone poisoned me or something. I just want to say goodbye.
Hey. You pretending you're in an affair with my wife?
Yeah, we're all pretending.
Tell them where you were 6 months ago, Russ.
I had a breakdown. I had some paranoid tendencies. I had a right to be paranoid.
He's making all that up. You know that, right?
Yeah, of course.
Why are we assuming he's lying and she's telling the truth? Maybe she picked him because he's vulnerable. There's something off about her. I can feel it.
Greg, Lorenzo Wibberley. Dr. Wilson said you'd be here. I just thought it was nice of you to write that letter, and I wanted to tell you that you don't have to feel bad.
Why didn't you graduate?
He failed me on that paper you switched. I bag groceries. Life works out weird sometimes.
You're testing her for a brain tumor?
That's what I told her. I told her it was customary to talk during MRIs.
There's nothing in the paralimbic system, amygdala.
Because she's using the language part of her brain and bypassing the emotional. She's a psychopath.
How are we 6 seasons deep and only now we are getting an episode with a psychopath? This is way overdue. But why is psychopathy so innately interesting? We fear the idea of a psychopath in society because they can appear charming, larger than life, and completely normal on the outside, but look beneath the surface and they're anything but. They're pretending to feel emotions, unable to form emotional attachments, and rampantly dishonest to the point of pure manipulation. Films show them as serial killers like Heath Ledger's The Joker or Anthony Hopkins' Hannibal Lecter, but in the real world, it isn't quite so dramatic. So where are they in society? Positions of power. Psychopaths actually rule the world, and for very good reason. They have all the outward real-world traits of a superhero, being calm under pressure, charming, inspiring people with words, fearlessness, willpower, and focus. Take the example of Alexander the Great. He's held up as one of the most incredible generals. As soon as he took the throne, he slaughtered rivals, including his own cousins. His mother even had one of her daughters burned to help him rise to power. But do psychopaths even know that's what they are? This is a tough one to answer, as many psychopaths don't seek support since it isn't inherently distressing to them. In fact, it's more likely that they're dragged through therapy or the courts by a family member and pick up the label in the process. But even if they don't know about the exact label of how they feel, they understand that they have a natural ability to manipulate and deceive others. Those inconvenient things called emotions and a conscious make for easy leverage. In one psychopath's actual genuine own words, we are evolution's next step. We don't allow silly emotions to cloud our judgments. With that psychopathic perspective in mind, then it's likely most of them know that they're different, even if they don't know what they're deficient of. That's because psychopathy is mainly genetic, and so they've been that way since birth. It's also more common than you think, with conservative estimates of 1 in 100 people being affected, although that is 3 to 4 times more common in senior business leaders, and as many as 30% of us will have some psychopathic traits. Either way, our patient may not feel emotion, but she'll definitely feel more unwell if we don't figure out what's wrong with her. So what could this be? Well, if she's a psychopath, then she could have poisoned this co-worker, lover, possible future assassin, which means she had to handle the poison. Surely the substance she used wasn't anything too aggressive, as Russ is still alive and shooting. But then if that was the cause, why is he better and she's still unwell? Oh, I have a theory. His chronic alcohol abuse induced a drug clearing pathway in the liver called the CYP450 pathway. This is known to happen, and it's possible then with the poisoning that he cleared the drug quicker than usual because of it. Since she doesn't pick the drinkable types of poisons herself, when she was exposed, then she didn't have the same protections. So what toxin could cause ringing in the ears and be cleared by the liver? Aspirin could potentially do it, but so could lead or mercury. Either way, definitely need more clues. By the way, can you imagine the moment they casted the ugly husband? Oh yes, yes sir, you are perfect. If you ever wanted to know the definition of a backhanded compliment, there you have it.
Psychopaths always fascinate me. I'm Dr. House. How long have you been a psychopath?
Is that why you were asking me all those weird questions?
She got the creeps around you. You have an undiagnosed heart problem that could kill you at any moment. We believe that your mental abnormality is related to your physical one.
What do you want to know?
Your coworker's story was true. You poisoned him.
No, I gave him a little Valium and an emetic.
I assume he was cool with the whole seducing and firing part, too.
He got sex every Thursday night.
And what are you getting out of your marriage?
Bill has a trust fund.
Told you he was rich.
I'm not so different than anybody else. They're all out for themselves. Difference is I could admit it to myself.
Psychopathy plus cardiac arrhythmia. Go.
Psychopathy is generally just genetic. Nothing you can do about it.
Tertiary syphilis can cause pseudopsychopathic syndrome and cardiomyopathy.
Start around penicillin.
You gotta do something about 13. She flouted both my authority and yours.
Your problem, not mine.
Only a psychopath could completely deny poisoning someone, then say, oh, it was just Valium and an emetic, which literally makes people vomit. And the team are looking at her psychopathy as a symptom alongside her heart issue. Spicy. They're thinking heart because some ear pathologies like pulsatile ringing that correspond with your heartbeat can be from there. So now they're wondering what can cause heart problems and psychopathy all at once. There are two ways really that constellation can happen, either a whole system's disease or something that increased the intracranial pressure so much that it started interfering with the heart. Usually though, for the pressure to rise to that degree, the patient would be pretty much unconscious, and she seems pretty with it. That leaves the whole system's disease process, so what could that be? Metabolic could be Wilson's disease. Infectious could be HIV, but would be quite unlikely to miss. Degenerative could be Huntington's disease. That would be really interesting with refocusing the plotline on 13. Neoplastic could be a brain tumor, and even a pheochromocytoma spitting out excess adrenaline. Inflammatory, potentially rheumatic fever. It could have started after she got a throat infection from being less than faithful. And toxic, again, could be lead poisoning. I mean, it seems like she isn't deficient in enemies, so it'd be a creative way to get even. Either way, I definitely want to have a copper level and ceruloplasmin for Wilson's, do an infectious disease panel, and check for high urinary levels of adrenaline while scanning her head and getting an autoimmune screen. The insurer definitely wouldn't thank me for that panel if I was in the US for sure. Pricey. Although we can't really put a price on a human life though, can we? Well, my travel insurance could. They said I was worth £15,000 if I lost an arm, £15,000 if I was permanently disabled, and a whopping £5,000 if I die before the age of 75. I need to know how they came up with those figures. At least there's comfort in knowing that my payout isn't worth poisoning me for. Either way, I think Wilson's would fit pretty well here, so that has to be my first diagnostic guess. Now let's get more clues.
There's no way to know that one seminar paper is going to destroy this idiot's life.
He's probably happier than you are.
I'll go find out. How's work? You happy with it? It's a job. Is that your yard? That's nice.
That sugar maple, 100, 150 years old. It's like paradise.
So what are the boxes for?
I'm moving.
You're losing your home.
Hey, it could be worse, right?
How?
You okay? Do you want some water?
Are you threatened by me?
Not at all.
Well, you should be. You let him know what I told you, I will sue you for everything I lose in the divorce.
Can I have your arm, please?
You broke it!
13 is about as intimidated by our psychopath's newfound jelly arm as the Turkish shooter by the Olympics. He definitely prepared for an assignment, and the Olympics wasn't it. Either way, I'd like to think that the solid bone should be able to resist a simple turn of the arm, so something must have weakened it. We call this a pathological bone fracture, and it's usually caused by a lytic lesion that's essentially eating the bone from the inside. So what can cause psychopathy and heart problems? Multiple myeloma would be an obvious cause, as that can crank up the calcium levels, which can lead to psychiatric disturbances and potentially mess up the heart rhythm. It would be incredibly unusual to see it in a lady in her late 20s though, as most cases are in men over 65, but this is house, so never say never. It could also cause anemia and kidney failure, so there's something to look out for. Potentially they can diagnose it using something called electrophoresis, check for something called M proteins, and treatment would be with chemo or radiotherapy, but only about 70% survive 3 years. That's bad news for inheriting her husband's trust fund, as he would more than likely outlive her. That is, unless a tragic accident befalls him early. Also interesting to see that House was hoping that what his med school mate lacked in career progression, he made up for in happiness, but those hopes were just incinerated by the discovery of his home repossession. And even then, he states it could have been worse. If that doesn't pull at House's guilt strings, then I don't know what will. Either way, we need more clues.
She called Cuddy and demanded that I kick you off the case. I backed you up.
Protein levels, kidneys, arrhythmia. Could be paraneoplastic. I'd say lymphoma.
Get her to radiotherapy.
You definitely ruled out everything else?
We could still check for environmental toxins. Can you find out all about her landscaping class, where it was, details like that?
Yeah.
So when you watch Star Wars, which side do you root for?
From what I hear, you never visit patients. And now you've come to chat with me twice. Dr. Hadley made a joke yesterday. She said I sound like you.
The rest of us are born with consciences.
So if you know your conscience is just an animal instinct, you don't need to follow it. That's why you're talking to me.
You lied about your landscaping class.
Every Friday morning we had a conference call with London, so the night before I would just go.
That's your excuse.
I need this job to feel like I'm accomplishing something on my own. That's why I lied to you. I just want you to know the truth. You know I love you.
You're not going to sue us. We will remove Dr. Hadley from all patient contact.
Are you by chance gonna cry? Because that's one I just can't do.
You called the medical board? Accusations of sexual harassment. You don't think I know it's you?
Get out here now. You're completely overreacting.
You'd be pissed off too if you were me. I don't know, you're just about as emotional as she is.
I'm sorry for firing you.
Something's wrong with her liver. Blood flow is backing up, spilling into her esophagus. This isn't lymphoma. We don't know what it is. Want to try something called a TIPS?
There's definitely a tip to the patient. If karma exists, then no amount of special diagnostics divisioning can save her from herself. Of course, it doesn't though, as you have smokers living to 95, and I saw the healthiest athlete need cardiac surgery because his heart scrotum, the pericardium, decided to start eating itself. We try to find patterns in things, but the world is really as random as it seems. Either way, it seems her symptoms aren't taking a random direction as the momentum is thoroughly pointed downwards. She's bleeding from her stomach as the blood pressure backs up from being unable to get past her liver and therefore shunting to some of the veins in the stomach. Foreman believes that they'll be unable to stop the bleeding from the point of exit, the stomach, and so need to catch it at the original source, the liver. So what is a TIPS procedure? Transjugular intrahepatic portosystemic shunt. Oh, it has a ring to it. Basically what it means is blood skips the liver, meaning that it can go straight to the big vein that drains into the heart where it should. What that also means is that the blood won't get filtered by the liver, so toxins can build up if it is bypassed for too long. What it will do though is buy time to figure out what's wrong with her in case it's possible they can reverse it. But what could that be? We've now got kidney failure, liver failure, and arrhythmia as well as psychopathy as a possible symptom, but probably not. Wait. The patient said a bit of a misplaced statement there saying, are you gonna cry? Because that's something she's never been able to do. What if that's actually a symptom of dry eyes? Oh, I've got a seriously spicy theory. Being a psychopath, she's all about appearance. That helps her manipulations land much more effectively. She mentioned she gave the person she poisoned an emetic and sleeping tablets, so clearly she knows how to use drugs to her advantage and their functions. Maybe she was also using diuretics to stop her retaining water and keep her weight down. If her abuse went a bit too far, then that could have led to the kidney and liver failure, as well as dropping her salt levels, causing the heart arrhythmia and the ear symptoms. Oh, that explains everything so perfectly. Diuretic abuse has to be my second diagnostic guess. Oh, I think I've cracked it. So perfect.
Do whatever you think is right.
I'd give her a day, 2 days the most.
Primary hepatic fibrosis.
Start her on steroids.
What are you doing?
Paying Wibbley's mortgage for a few months.
I'm sorry to bother you, but I was told you're Valerie's sister?
I was even more surprised you got tested as a donor.
Wrong blood type. But why? Our dad was a mean drunk. All his abuse, it just changed her. It made her cold. Psychopathy is a symptom. She changed, and right around adolescence.
The raw food diet, go fulminant.
Oh, we have the epiphany moment. Raw food made it worse and psychopathy was actually a symptom. That takes me back to my thinking right at the start when the team were considering it. Raw food diets generally contain a lot of legumes, nuts, fruit and vegetables, and particularly Foreman at the start did say high in nuts. I mean, it could be she was low in B12 because of the raw diet, but that doesn't necessarily explain the psychopathy. Maybe they're trying to get at a nutritional excess rather than a deficiency. Nuts are quite high in potassium, magnesium, zinc, and copper. Could that be it? Nuts triggering Wilson's disease. That does make my initial suspicion a lot more likely. Oh, that would work so well here. Also, maybe the dad was a drunk because he also had Wilson's and then never got diagnosed because they blamed his liver disease on the booze instead. Spicy and easily missed. Oh, I like it. Now, if they chelate the copper, there's a small chance they could reverse the effects on the brain. If it is that, would she then come clean? Oh, this episode is so good.
Nuts are high in copper. It's Wilson's disease. Start her on chelation.
You're gonna get better. Your body has an inability to process copper. Even if it cures her, it's not going to make her love you.
I was happy before.
It wasn't real.
It felt real. Maybe that can be enough.
I can't accept this. I got an A+ with your paper. I was an orthopedic surgeon for 10 years at New York Mercy. I had a gambling problem. I tried to cover it by overbilling some Medicare patients. No, I could get another place.
Do I have to shove it down your throat? Take the damn check!
When you're better, I'm gonna take a long vacation.
You're pathetic. You know now. How can you be this pitiful? The idea of spending the rest of my life with
Valerie,
Why'd you do that?
Because he's pathetic.
He hasn't changed. But you have. Treatment actually worked on your brain. What do you feel?
It hurts.
Why are you here so late?
Discharge summary.
First treatment was full mental therapy.
Are you serious? It was Wilson's! Finally, I got one, and so early as well. Definitely taking that, and even with a diagnostic guess left to spare. Interesting to think that someone could live a life like that and then reverse it. Of course, that would be incredibly unlikely in the real world, but still possible. We know the brain can reconnect and adapt its neurons even after our teenage years, so seriously good writing from the show's producers. Overall, this has to be a top 5 episode for me. 8.3 out of 10 entertainment, 8.1 out of 10 accuracy, and 8.6 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one where Not Your Average Drug Deal takes place.